Hi, I'm Dr. Phillip Chang. My practice is Aesthetica, Cosmetic Surgery and Laser Center, and we're located in Northern Virginia. I'm frequently asked how a patient should choose a plastic surgeon. Sometimes they're interviewing me, and so what I usually tell them is there's not a single way to do that. Probably the most important way, though, is to choose a board-certified plastic surgeon. Well, that's the first way. And I'm just going to list the ways that you can choose, and then I'm going to go back and tell you what all of that means. And so these are the ways that I kind of think about it if I were a patient trying to find someone. So again, the first way is to find what we call a board-certified plastic surgeon, certified by the American Board of Plastic Surgery. And there's actually a symbol, which is basically a circle, that basically indicates that the doctor is a board-certified plastic surgeon. The second way is to take a look at their pictures. So all of us plastic surgeons, we basically post our pictures or put them up on the internet as before and afters. And so what you want to do is to take a look at those pictures and to make sure all of those pictures actually belong to that surgeon. A lot of times, especially with a lot of non-surgical devices, laser hair removal, skin tightening procedures, laser removal for fat, those sorts of things. A lot of offices in our advertisements will show those before and after pictures. But what you really don't realize is a lot of those pictures don't belong to that surgeon. They're company pictures made by the device companies. And so that's kind of the second way to choose someone. The third way is take a look at the doctor's office and their office staff. So what you'll find is when you go to their staff or see their office and see their staff, or maybe even online, is that the staff doesn't look quite right. Their lips are big, or their cheeks are big, or their brows are high, and they just don't look quite right. And so if the staff doesn't look quite right, you know that the other people in that staff or even that plastic surgeon is actually doing that procedure, and so that's already an indication for you that that's probably not the right place to go to. And to toot my own horn, I think my staff looks very natural. They look very real, and that's kind of what I pride myself in. The next is kind of a corollary of that. If the plastic surgeon himself or herself just looks off, they themselves have big bloated lips, big cheeks that don't really match their face, then that's probably not a person to go to. I can't understand why anyone would go see a injector or someone that's putting something into your face when they themselves don't look quite right. So those are that's another way. And then the last way, or maybe not the last way, but another way is you need to get referrals. So a vast majority of my practice is actually referral based. I've been practiced now for about 15 years, and so I've treated enough people in this area as well as elsewhere where my previous patients will refer me patients. And so probably at least 50%, if not more, of my patients are simply through referrals as opposed to through advertising anymore. So again, just to repeat myself, make sure that the surgeon looks natural. Make sure their office staff looks natural. Make sure you get referrals from other people. And the office itself can give you some of those referrals. Make sure that the pictures are done by the plastic surgeon themselves. Make sure that the plastic surgeon is a board certified plastic surgeon. And if you get many of those categories right, I think that you'll find yourself with a good person to go to that can either treat your face, treat your breasts, treat your body, and get a good result.